Today, I'm really pleased to introduce our speaker, Mr. Ramon Hernandez. Just as a part of the introduction, June 5th of this year marked 45 years since the first published report of what later became known as HIV/AIDS. It was June 5th, 1981, and it was an unyet identified disease that was ravaging, especially men who have sex with men in the United States. What I find interesting is that marked 45 years. That very same week, just to give you some perspective, I graduated from Freeland High School and I was 17 years old. So next month I turn 63, and yet there's still no cure for HIV/AIDS. Some of you know that I devoted probably half my career, about 20 years, to the cause of HIV/AIDS with the annual AIDS walk, testing, and outreach. I asked Ramon to come here today to talk to us about a lot of the new developments. We know that HIV/AIDS, there's still no cure. It is a chronic and manageable disease, but people can still die without intervention, without medical intervention. And I think it's been a while since we had a speaker on this topic. And Ramon is with the Hearth home, which is part of Great Lakes Bay Health Centers here in Saginaw. They are a free, federally funded clinic that provides an array of medical and psychological treatment. And they've really spread out in this area. What I do want you folks in Mount Pleasant, I'm familiar with the Central Michigan Health Department. I've also asked Ramon to share some statistics relevant to Michigan, in particular looking at Saginaw Bay, Midland counties, but also looking at Isabella County as well. And just so you know, somebody said to me once, well, HIV/AIDS isn't really a gay issue. And I was really kind of offended because according to the Centers for Disease Control, the CDC, 65% of people living with HIV/AIDS are classified as men who have sex with men. And so I appreciate Ramon having you here. Ramon's going to lead us through a PowerPoint and then take any questions. And Ramon, thank you so much. Why don't you come up?
So my name is Ramon Hernandez. I'm from Great Lakes Bay Health Center's Hearth home. I'm the prevention manager there. And yeah, so this is the little presentation about the Hearth home. So first, the little ground rules. Let's be open and honest, understand or listen to understand. Keep sidebar conversations at a minimum, and also participate. This is conversational. And then also minimize technology use and also respect time. All right, so what I'm going to go over is who we are, what we do, and resources that we share and also provide within the community. So I'm going to go over a couple things, kind of like reminders of whatnot that I kind of want people to know going forward from this presentation. So HIV spreads through blood, semen, vaginal and rectal fluids, and then also breast milk. Who is at risk for HIV? Everyone. What is PrEP? PrEP is a medication, pill or injectable, to prevent HIV and is for everyone. What is PEP? PEP is a medication used 72 hours after the exposure of HIV. All right, so I'm going to go into basically some of the guiding principles that we use at Great Lakes Bay Health Centers in terms of dedication to employees and also the community, and also in respectful manners of getting people what they need. Then also our little mission statement, which we change lives because we care. And then just going over the service area, I think now total, we're at 36 or 37 sites within the Saginaw Bay region, and then also a little bit up in the Ute. And then
How many of the Saginaw County or other county,
locations.
these centers here,
Yep.
these are in Saginaw County only?
Yeah, Saginaw County, Bay City, and then some a little up near Tawas, I believe, or however that.
Some up north as well.
Yep, some of them. All right. And then just the array of services that we offer. All right, so I'll go right into the meat of it. So the Hearth Home is a HIV prevention and outreach program acquired by Great Lakes Bay Health Centers back in 2002, which the Hearth Home offers community-centered and community-friendly client-centered prevention for Saginaw County. And what we do primarily is try to reduce the stigma of HIV/AIDS through support groups, counseling, testing, and also risk reduction and education. Which with that, we also offer contraceptives to the community and also PrEP and PEP education targeting high risk areas within Saginaw County. All right, the Hearth Home. So at the Hearth Home, we basically are prevention and support services. So we offer free HIV testing, Narcan safer sex materials through our drive-through, PrEP and PEP education and services, HIV/AIDS education, artists, which is basically if someone has left Michigan and are coming back to Michigan and they don't know the necessary providers to get back into care for HIV, we assist them to get that and not have them fall out of care coming into Michigan. DoxyPEP and DoxyPEP referral and education. And DoxyPEP is just an antibiotic used to treat specific STIs to prevent them within, I believe, like 72 hours. PCC, so basically that is kind of behavioral reduction or analyzing behaviors within our testing of like kind of getting better processes in terms of what we can do to prevent HIV and what is available. And then also community outreach. This is just a picture of our drive-through window where you can get Narcan, condoms, lube, any type of thing that is needed or whatnot, or information.
Is
that free?
Yes, it is free, FREE. All right, so Hearth Home, as I said, provides free HIV testing in the community and on-site. What we use are OraQuick, which is the mouth swab, and then also the Abbott Determine, which is the blood draw, or blood prick, I would say. Test is within 20 minutes. Within our testing session, we go over counseling and behavioral modifications, and then also going back to education about PrEP and PEP and HIV, and then also accessing safer sex supplies within the visit to make sure that going forward, our clients or patients have the access to whatever they need and however they're using. And then also if our client needs any type of assistance, whether it's a primary care provider, if they fell out and haven't seen the optometrist in a while, we kind of like are the catch-all of the community within Saginaw. So there's a lot of people that come into the Hearth Home that don't necessarily get HIV tested. We offer it to them, or they need help to get back on Medicaid, Medicare, and then anything else health related within the stuff that we provide as Great Lakes Bay Health Centers. All right, here's one resource that we also do provide to people is free HIV testing at home. One of the resources, it is Take Me Home. So this is a mail HIV test that you can get in the mail for free, and the packaging is also is ambiguous, I would say is the word, confidential. So you can get this shipped to your home, and even if it's not for you and you know someone that needs a free HIV test, you have it on hand. All right, and then just going over, we do offer free condoms, lubes, and HIV testing through our drive-through Mondays, or hours, sorry, I didn't mention the hours of our operations. So Monday through Friday, you can come into the Hearth Home, get whatever you need. we're open 9 to 5, and sometimes we're earlier there, so 8:30, I would say. So yeah, and then also we can do condoms by mail if you know anyone or young individual that doesn't necessarily have the access to the stuff. You can definitely share this QR code with them, and they can get their stuff free and confidential. All right. We also want to kind of give more accessibility in terms of um, our HIV testing than other programming. So we decided to offer walk-ins, but also if someone is more regimented to having an appointment, because it gives them like a thing to do or whatever. We offer free HIV testing booking as well. And then gonna go further into kind of our program with Prepping the Peninsula. This is just our program with the Michigan Department of Health and Human Services to prevent HIV statewide using PrEP, the medication and/or injectable pill, to all Michiganders. All right, and then one of the other initiatives that we have at the Hearth Home is making sure that our community within Saginaw or the city of Saginaw has access to condoms. So if you go into the bathroom at the Red Eye, you'll see a little fishbowl of condoms and some resources that are on the fishbowl in terms of stickers. And they're able to get condoms in a private way, I guess. So, all right, so Prepping the Peninsulas. This is one of the programs that we have in the Hearth Home. The state gave us this program to develop. So I developed all the policies and then also the structures for this program to be statewide. So I work a lot with all of the health departments across Michigan and also the other agencies as well. So Prepping the Peninsulas. So Prepping the Peninsulas is basically geared to make sure that if someone wants to get on PrEP, that it's easy to get on PrEP, and that no matter sexual orientation or whatever, that it's a basic need within Michigan that if you want to prevent HIV, then it doesn't matter what type of background that you come from, we can get that for you, and then also make sure that you don't acquire HIV and keep you in care and happy. So this is just more information. For this program, you have to be HIV negative to be on PrEP and treatment. But here's just the simple steps of how you can contact us, set up a virtual visit. The lab work that we do, we utilize Quest Labs because they are the biggest lab within Michigan, and it has more access points for people, whether upstate, downstate, to be able to get their labs done as well. All right. Another thing that we have at Hearth Home that we recently begun or reinstituted is the HIV/AIDS task force. So this is just a collaborative task force for agencies around Saginaw Bay and Midland that if they want to attend, and they don't really have to be any person that is specific to the health field. If you're just a community individual that wants to like help people within Michigan not acquire HIV, then or even individuals that have HIV are on here as well. So just basically mobilizing with a lot of the reductions in grant funding that a lot of other agencies are experiencing, trying to kind of consolidate and also make sure that if one organization doesn't have that resource, that another can help and be like, hey, we have this, we don't utilize it, and let's collaborate. All right, so points of attention, and then after this, I'll get more into like the granular stuff with the whole state of Michigan. So points of attention. HIV spreads through blood, semen, vaginal, and rectal secretions, and also breast milk. Who is at risk? Everyone. What is PrEP? PrEP is a pill or injectable to prevent HIV for everyone. What is PEP? PEP is a medication used 72 hours after exposure to HIV. Any questions? I know that was pretty rapid.
How, two questions on, PrEP. So I believe, is it one pill? Or is it, you take it every day or, and how effective, first of all, how effective is it at preventing HIV? And then, if I'm low income or no income, can I get that or?
Ramon, can you restate the question on the microphone?
Yeah,
Because
so
you're,
the question was how effective PrEP is, what is PrEP, I believe, and um what routes that you can take it, and then also if a person is coming to the Hearth home and doesn't have insurance or they're underinsured, what are we able to do to get them on PrEP? So at Great Lakes Bay Health Centers, we have a sliding scale fee determined on either salary or a letter support saying that, hey, I'm in a financial situation that I'm not able to cover bills, which this sliding scale covers lab visits, actual visits with a provider, and then also pharmacy. So that also can account and help a person get on PrEP. And not just PrEP, but also any other service at Great Lakes Bay Health Centers is offered that to them if they aren't able to pay or don't have adequate insurance. Also going back to the question, how effective is PrEP? PrEP is, I believe, is 99.9% effective as an oral pill. There's a little bit of difference when it comes to injectables, but I would say it's probably the same with an injectable PrEP as well.
You have to take it every day.
Yeah, so how PrEP is taken is I kind of revert it as birth control, but for HIV. So you take one pill, one pill, either however you want to regimen it in the morning, middle of the day, but it's once a day.
How long? Ever?
Uh, it depends. However the person wants to stay on PrEP or also if they're financially set to do that as well. But there is also many options like injectable PrEP that you only have to take every 8 weeks. So it's every 8 weeks, and then they recently came out with another shot that is only twice a year.
With the cost.
Oh, the cost. So the cost, it for the generic PrEP, I believe it kind of dwindles down to with a GoodRx script or the little GoodRx to make things affordable. I believe it kind of boils down either to like maybe $8 or $8 or $9. Yeah, so it's pretty affordable.
Yeah.
Are there medical people on staff?
Yes, so our part of my department is special immunology. So we are the prevention side, but we have a very good relationship with our care side that is the clinic. And what was the question again? I forgot.
Are there medical people?
Yes, there is medical people on staff.
You're pre-18, do you serve minors too?
I would say within the state of Michigan to get on PrEP, you at least have to be 15, or there is I believe a kilogram. 89 kilograms is an eligibility for PrEP. So if someone does want to get on PrEP very early, it depends on the authorization of the parent and then also what their circumstances are.
Now, I know you don't have a site in Mount Pleasant. I'm thinking of our Mount Pleasant folks out there. Can they get free testing in Mount Pleasant?
Oh, for sure.
And where, can you tell the folks where they could get testing or treatment?
So for testing and treatment, I know the local health department there, I believe it's like Central,
Central
yeah,
Michigan.
Central Michigan offers that as well.
Is that both PrEP and testing?
Yep, PrEP and testing.
We do have a question from Mount Pleasant. I'm not sure if you'll be able to answer this, but they ask, recently, Great Lakes Bay Health Center decided to stop providing gender affirming care. Because of this, many are forced to switch to a new endocrinologist. Why was this decision made?
For that's not my perspective program. But not to speak on the behalf of Great Lakes Bay Health Centers as whole or at large, but my interpretation of that is the provider was leaving and they didn't necessarily have the tools to kind of implement a plan of transfer, I would say. So it was very much dealt internally on a executive team level.
Mhm.
So on kind of the people that actually work with the programs, we are very sad to see the program not eligible or not at our site anymore. But it was definitely, the decision was not made with a lot of people in mind.
Mhm.
They were going to start one at CMU Health as well. My endocrinologist over there told me about a year ago. He's told me to check back in a year, and so I did. And he said the two people that were going to start it there, one left the area and the other had a baby and decided to.
Yeah, it's unfortunate
And
because
so
yeah,
the program never got off the ground.
yeah, it's unfortunate because a lot of the people that we see in the clinic are the people that were also in that program. So it's a little struggle of, I know this, you're gonna transfer your care, but we can at least help you as much as we can in terms of making sure that you're getting equitable care that fits whoever.
Do you have a number of white, Latino, Black, people of color that you actually serve, deal with HIV? Too?
On staff,
Yeah,
I would say.
your staff are also like people with cases, people
Oh.
have it.
Yeah, I would say staff, we do have a lot of a good mix of representation in terms of community, and then also the demographics that we see specifically in the city in Great Lakes Bay Health Centers and Hearth primarily are Latino, African American, and then also Caucasian individuals as well.
So I just got a comment from Mount Pleasant that said that we have one person here in Mount Pleasant who is able to add some expansion to that initial question that they asked.
Nice.
So if the individual would like to speak, I think, let me increase my volume here. I think we should be able to manage that. So if they would like to speak, they're more than welcome to.
Okay, over here.
Oh, you can hear me from there? Okay. My name is Candy Tomlinson. I'm a member of the LGBTQ Policy Planning Committee for the Michigan ACLU. Can you hear me okay?
We can barely hear you. You might need to get a little bit closer to the computer so the rest of us can hear you.
Okay. Can you hear me better now?
I think we can hear a little bit.
Over to where Jim was.
That's what I wondered.
Oh.
Okay. Okay. Can you hear me better from here?
A bit better, yes.
Okay. Okay. My name is Candy Tomlinson. I'm a member of the LGBTQ Policy Planning Committee for the Michigan ACLU. I do know that Trump has put a lot of pressure on Michigan, blue states especially, that are not supporting him. And they're threatening the doctors with prison for doing gender affirming care. So I don't know where we are in that. Our meeting is next week, but that's the last that I heard.
Donnie, can you repeat what she said?
She essentially said that Trump is putting pressure on these organizations and they basically they are threatening doctors and other medical professionals with drastic measures and if they engage in gender affirming care. I was repeating it for everybody so they could hear.
Yeah, with prison. They're threatening
They're
the doctors
threatening with prison,
No.
especially.
and parents, by the way, and parents.
And
With
they're
prison.
threatening parents too.
Thank you.
Right, right.
I'm glad you're there. My
Thank you
pleasure
so
for
much.
Contributing.
No, thank you.
Yeah, we really appreciate that. Thank you.
And that affects, we're seeing it both in healthcare
Oh,
and
sure.
education, aren't we?
Yeah.
Thank you, sorry, Ramon.
No, you're good.
Yeah.
And then this is just the contact information for the Hearth, and then you can jump right into the numbers, which is only like 6 slides.
Fine, and just one question though for you, with Central Michigan, it would be the same health department if someone tested positive.
Yep.
Would they get someone into care? That would be right there.
Could you
Yeah.
repeat the question for everybody too?
Yes. I was trying to remember the question.
Tom, can you restate your question?
In Mount Pleasant, Central Michigan Health Department, if someone tests positive, do they then help get that person into medical care?
Yes, so they're going, when they acquire a positive in their clinic or whatever, depending on the provider that they have, that's either like infectious disease related, they're able to be getting care, but also I know that Mount Pleasant utilizes Great Lakes Bay Health Center's special services to also kind of offset that increasing numbers when it comes to provider access, or if there is a provider in the area.
Got about 5 minutes.
All right, so I'll jump into this very quickly. So this is a care continuum of HIV and also a bunch of like little things. So this graph over here is enrollment of Ryan White. Ryan White is the premier, I would say, grant that people operate with HIV. So basically what this is telling us that people are getting into the program and that there's more adherence. And then it also has like the map of the service area that we exist in as well. So I will get right into that. And then also, they're just about to, the Michigan Department of Health and Human Services is also just about to publish this as well. So you all are seeing what is in real time. So for the care continuum within males, we see that there is a prevalence of males that have HIV versus women. Sorry, trying to follow my notes as well.
You are good.
All right, so looking at this graph, the breakdown, most people in our service area living with HIV are male, and it's also consistent with the national trends. But however, when we continue to see the disparities among racial trends, which is right over here, while viral suppression, which is making sure that they're keeping their HIV at bay with medication and making sure that they're undetectable, it's a little lower within African Americans and Latinos versus the white counterpart. This note right here, if it's not more than 45 people from the generated information, that's why there is some American Indian and Asian that's missing on here. They didn't kind of meet the, yeah, for the data, but yeah, so that's kind of what we're seeing. It's a little, yeah. And also that just because like African American and Latino, it doesn't mean that they're individually making these choices or whatever. This reflects kind of broad barriers in terms of transportation, access to healthcare, housing stability, and also stigma in terms of being able to be linked to care. All right, so I'll go into age. So this on the top left is just telling the story of how age is important within this. As we see, older adults 40 plus have the strongest viral suppression outcomes versus people that are 20 and 39. So there's more older individuals that are adhering to their regimen in terms of being able to have access to transportation, medical care, also medications. And while that may reflect some challenges within like the younger demographic, it's just more or less of remaining in care, remaining engaged in care, and also changes in employment, insurance, relocation, stigma, and this also reinforces the stigma of why linkage to care is important within Michigan.
What is the light versus dark blue? I'm sorry.
So light blue is going to be in care, and the dark blue is their viral suppression. So if they're in care, that means that they are being virally suppressed. So if they're in care for the younger ones, but also if they're virally suppressed, meaning that are they able to make their appointments recurringly with their provider? So along with the other things that I've stated with like transportation, insurance, relocation, job, that kind of aids within why viral suppression is lower within younger individuals than older individuals. Mhm. Yeah, and then the next one, insurance. It's interesting to see the relationships and outcomes between insurance. Individuals with strong insurance coverage, the first two little pillars, or have Ryan White coverage, generally demonstrate better viral suppression. And then this basically highlights how enrollment assistance and benefits navigation are important, and that it's just not medication alone that serves as an indicator of success of care. County comparison. So, oh, actually, this is transmission rate. I'm so sorry. So what this graph on the left is basically saying is that there's a higher prevalence of men sleeping with men acquiring HIV. We know that. But there's also people with drug addictions also. And then also men that sleep with women that have drug addiction, men sleeping with female sleeping with male. And then there's also kind of a scary majority of they don't know how they acquired HIV, but later down the line, they either found it, but they're basically what I'm saying is that between all of the acquisition types, it's kind of similar in general, and one's not doing more worse than one other. So what we're seeing is that we're catching people at late stages and not early. So that is one concern as well. And then also this is the breakdown in terms of county: Bay, Clare, Gladwin, Gratiot, Isabella, Midland, and Saginaw. There's nothing too wild within the graphs right here. There's no particular county that is worse than others. The numbers based on the people that are getting tested. So in Gladwin, there's a smaller percentage of people getting tested, or catching or linking to care. So that is also one as well. So overall, the counties in our service area perform relatively similar, while some have some differences. There's nothing that dramatically stands out. So the internal, did you have a question?
I just wanted to ask about, when I talked to you previously, you mentioned there were some higher rates of HIV infection in the Upper Peninsula. Is that true?
Yes, that's still true.
And why is that?
Could you repeat that for everybody too?
I understand that there's some higher rates of HIV infection in the Upper Peninsula. And can you explain why that, or who is that affecting?
I think it was picked up on there.
Okay, nice. So in particular, what we're learning within like the past 2.5 years is that there have been some significant outbreaks of HIV in the Upper Peninsula, particularly in heterosexual relationships. So a lot of this is either based on whether they're not getting, the people that live in the Upper Peninsula don't have programs that do HIV testing. I'm pretty sure that they are, or maybe that there's low testing volumes that people were not. Correct. Yeah, education, access, and access to contraceptives, whatever it may
When I
be.
was up there, it was 90 miles from that.
Yeah,
So you don't just drop in.
no. Yeah. And then just to go over pretty quickly with this next slide, this is just 3-year totals in terms of our selected regions and then also statewide. Basically what this is finding out is that there is very low testing volumes, and that we're discovering people later in their HIV journey that we potentially could have gotten given more testing access to other individuals, which the good thing is that we know is that what we're doing in terms of linkage to care is working, and there's nothing that we have to necessarily rethink the wheel or reinvent the wheel. It's more or less that we have to make sure that people are getting access to HIV testing, and then also the tools to also not acquire it. And this is just some little trends, but other than that, yeah, that's pretty much it.